Hello, I'm Dr. Ron Fair, and I'm here to demonstrate the Incontinent Kit to you. The Incontinent Kit was invented by me to provide help for the people who are bedridden and cannot get out of bed for their regular toilet function. 12 years ago, I was visiting with a longtime patients of mine, friends, an 85-year-old and 87-year-old couple, and she was taking care of him in his hospice setting at home. And while we were watching the ball game, he had a bowel movement, and she suggested that I go home. I said, "No, Dorothy, I'd like to stay here and help you take care of him." When I went home that night, I thought there must be a better way, because diapers are no solution. Dorothy is performing a function that in a nursing home requires 32 steps for the cleanup procedure. She's not alone. The National Health Institute and the Kaiser Family Foundation say that there are 2 million people who are experiencing bedridden wearing diapers. And 80% of those people are wearing diapers, and the majority of them will eventually suffer incontinent-associated diseases. The diaper rash begins and leads to bed sores, and ultimately can lead to ulcers of the skin and the buttocks and the genitalia. As a result of this toxic effect of the feces and the urine that are mixed again on the skin, these people are embarrassed, they're angry, and they're depressed. Now, changing a baby diaper is no big problem to any of us, but changing an adult diaper is a major traumatic experience that is not pleasant. To resolve this, I invented the Incontinent Kit. The kit contains a supply of 30 days of attachment inserts, bed linens that are necessary for the process for the apertures to fit into the depression in the cavity of the mattress, has a guideline for caregivers on how to use the kit, and all of the supplies that are necessary, including the barrier cream, cloths, and rubber gloves. This is a transition now to a demonstration on how the kit performs. Ken Mannequin has just had a bowel movement, and he needs to have it taken care of. So, Ken, having had his bowel movement, like at home, what we do is take toilet tissue and we reach down, and just like at home, we would wipe in, if we were using a toilet, and put the tissue down into the enclosure. I would then take out the barrier cream cloth that has a medicated coating that it will apply to his buttocks and the genitalia to prevent any possible incontinent-associated disease from occurring. That cloth is also just tucked gently down into the attachment platform. Then I reach down with my hands and just take out the attachment and the bag containing the fecal material and urine, and dispose of it in the appropriate container. And now that it's gone, we take a fresh one with the bag attached, reach over, slide it under his buttocks, and make sure the depression of the bag is into the aperture, and he's ready for a future use of the same thing. And Ken is now able to put his legs down. He's able to relax in bed comfortably, and he has been adequately taken care of using the Incontinent Kit and preventing any involvement with the incontinent associated disease. He's been protected from harm, and he's now in a perfect position to be comfortable and have been hygienically cared for without having to wear a diaper. And it is now my intention to have a practical way for this Incontinent Kit to be used in nursing homes, in hospice settings, and private homes to care for the incontinent people who are now wearing diapers. And my goal is to provide an easier way to care for the incontinent persons by eliminating diapers and replacing them with the Incontinent Kit. And the question you may have in your mind is, will it work? And the answer is yes, it does work. And it has worked for 18 months in field trials and demonstrations. It is not yet commercially available to the public, but we are opening it to the pilot program to the public now. So if you have family or friends that may benefit from this, they're wearing diapers, we would ask you to have them look at the website, and you will have done a compassionate and a humane service that will help them regain the dignity and the quality of life they deserve.